Hey, it's Dr. Miller. I just had this really interesting conversation with a patient who is undergoing a lip reduction, and she asked me what is the worst thing that could happen. And after going through the typical kind of concerns that she may have, or may, unlikely though they may be, could happen after surgery, I said the most likely scenario, not very common, but if you were asking me the most likely scenario in patients like yourself who are undergoing this procedure, the number one concern that you may have is that you're not happy and you're not satisfied. And the reason is that if you take a look at all of the patients who have facial plastic surgery in terms of what procedure they're having, whether it be rhinoplasty or facelift or lower lip or upper lip reduction, otoplasty, if you take a look at all of those, lip patients and sometimes, ear patients, probably number one and number two, are often getting it because they were teased when they were younger. And while the surgery will make the physical component of the procedure, the physical component of that part that was being teased, that will be improved, it can't obviously address the psychological component all the time. Now I say all the time because interestingly I do work on victims of domestic violence, and they can come in and see me with a bad scar on their face, and interestingly I replace the scar that they got from their abuser with a scar that I created. And even though there's still one there and it does look better, it's still there, and yet the patients almost unanimously are thrilled with the result, because what they now see when they look in the mirror is something that they have on their face because they took the initiative, because they empowered themselves, because they were able to erase something that was there before. And those patients, interestingly, those patients almost never regret having the surgery and are often very, very happy. But the patients who undergo the procedure because they were bullied have I think a much higher likelihood of after the surgery still remaining hyper focused on that facial feature that was made fun of them when they were younger. They are often particularly attentive and hypersensitive to an individual who they're talking with, who is looking at that facial feature, and may it actually even be thinking really, really wonderful thoughts. My God, you have beautiful lips, or you have a great chin or something, and yet the patient themselves feels incredibly sensitive that, oh my God, there's yet another person who's looking at my lips. So how do I attend to this? And I think the first thing to do is to have this conversation. But the other thing I do here is I sort of have the patient recognize, okay, are you sort of doing this because there's a part of you because a part of you was made fun of that particular feature a lot of when you were younger, and if the patient acknowledges that, then that's a big step. And then we go one step more, and I said, okay, well, if you were bullied, was it on a facial feature that you yourself, honestly, can you be objective enough to ask yourself, you know what? Yeah, I was bullied, and it was on a facial feature that actually does exist. Objectively, independently, looking at this with my particular aesthetics, trying as best you can to eliminate the influence you had from being bullied. Yeah, you know what? My aesthetic is such that I actually don't like that. And that if you can do that kind of separation, the facial feature does exist and you don't like it. This is shorthand for you don't like it. Then absolutely go ahead and proceed with the procedure, but for the purpose because you don't like it, not because you were bullied. Because this part I can't cure. We can talk about it, but I can't cure. And one thing I really like doing with patients in having this conversation is that if the facial feature actually exists, but when I really talk to them, I wouldn't necessarily say like per se. What I typically is, this is a better way of approaching it, is they're not bothered by it. They're like, well, you know what? the truth is, yeah, I see what they saw, but I'm not really bothered by it. I tell them, you know what? Then don't do it. Why do it? Because those patients, if they do it, they may not erase this at all because they weren't bothered by it in the first place. Finally, this is a real important scenario that is this is a really important scenario, is what if that facial feature really doesn't exist, or it doesn't exist to the extent that the patient feels is incompatible with the degree to which they're unhappy with that particular facial feature. There's that incompatibility. In that case, I really advise the patient, of course, not to have the surgery. Okay, because again, doing a minor change, that's not those patients, unlike the victim abuse patients who taking that step of empowerment, they absolutely feel better. These patients, when the facial feature really doesn't exist at all, or it's so much more minor compared to their obsession with it, those patients aren't going to get better by doing the surgery. And I tell them don't have it done. Okay, so this is a really important conversation that I have with patients in general, and with patients in particular with lip reductions who ask me, well, Dr. Miller, what's the worst that can happen? And that's what I tell them.